Welcome back. We are now, and this week we're going to be covering another topic. If you've been following us and you've seen some of the topics that we've been covering, we started with understanding the crisis, understanding the math. Now you understand the care ladder, the difference in the level of care. Today we are going to be talking about people, specifically your people, the team you need in place before you need them. Now, before I even begin again, I want to do these videos in small, I don't want them to be too long. So I am going to cover this topic today and next week and what have you, because I really want people to get this information. And I feel that when I'm covering too much, people may not be willing to listen or watch the whole video because they're too long. So I decided I'm going to break them down. Even the ones that I've done before, I might do them again, just make them so I can have them on small bite so you can really get the information, because I really believe people need to know this information. I want to start with what I call the speed dial test with you today. I want you to answer these 5 questions for me right now in your head, or even if you're sitting somewhere and you're listening to this or you're watching me. If your mom or dad fell tonight, okay, there was a fall and they end up in the emergency room, who would you call first for guidance? Who would you call first for guidance? Think about it. Who would you call first for guidance? And do you have that person's number? If you got a call that your loved one or your mom or dad was in the hospital and they are being discharged from the hospital like tomorrow morning, is there a home care agency that you already established relationship with, that you know that they could easily deploy and service you that day if you needed them to? Whether you don't want to be doing this at 2 o'clock in the morning. You don't want to be googling a home care agency and just looking for somebody 2 a.m. in the morning or overnight while you're sitting in the emergency room. If you needed to figure out how to pay for long-term care without running out of money in 2 years, is there a financial advisor who would walk you this road, who has done this before and who can walk it with you? If you and your siblings disagreed about the care for your mom or dad, is there a professional who could do an objective assessment and help the family get on the same page? If you could answer, if you could answer all of these questions for me with a name and a phone number, great, congratulations. You are ahead of 90% of families. If you could not, and most people cannot, that's what today is all about. Today and next week. Because the time to build your team is not at 8 p.m. at night before discharge, when your mom or dad is being discharged from the hospital. The time to build your team is right now. Not in the middle of a crisis when you are trying to Google a home care near me, midnight or 2 a.m. What you need to do is build a team when things are calm so they are ready when things are not. And so today, that's what I want to talk to you about. So we talk about the 5 essential team members. Again, as I said, I don't want to make this video too long. So I may not, most likely will not cover all 5 of them. So you'll have to come back next week, or you have to come back the week after also, so you can get all of it together. So the 5 essential team members that we're going to talk about today. We'll give you the details, actionable guide for each member and what to do and how to put them together. Now, the team number one sounds like that's where we're going to start today. Team number one is the decision maker. Before anything else, your family needs to be clear about who makes the call, who has power of attorney, who has healthcare proxy. When a decision needs to be made at 2 a.m., who does the hospital call? This is not about who loves mom the most. It's about who can think clearly under pressure, who is available, and who your loved one or your mom or dad would trust to honor their wishes. If these documents are not in place, I want you to stop. Before you do anything else on this list or anything else that we're going to do, get power of attorney and healthcare proxy document drafted and signed right now. Right now. Before we even talk about the other people that are on the team, this is the first thing that you need to do. Because without them, when your mom or dad cannot speak for themselves, nobody is legally authorized to speak for them. Then the courts will get involved, and that's a nightmare itself. Nobody needs that. Okay? We're going to talk more about these documents in a few weeks, but I want to plant the seed. I want to start now. If you don't have power of attorney and healthcare proxy in place, that is your number one priority. You need to do that. You need to do that now. That's the team. That's the number one team member. We need to know the decision maker. Who is going to make decision? Again, as I said, it's not about who loves mom, who's closer to mom, it's about who can. Sometimes children, mom might trust, Bob to make the decision, but he doesn't live close by. He lives in another state. Mom might want the oldest child to make the decision, but that person is not close. So this is a decision. This is something that you need to pull family together and start having this discussion about these two documents need to be done. They need to be drafted. They need to be signed. They need to be in a place where anybody, so you can find them. That person who's in charge is responsible. That decision maker in the family has it. And it has nothing to do is that you're more important than another member of the family. No, everybody in the family has their role. Everybody in the family has something that they're supposed to do. And this one is for the decision maker in the family. So if you don't have um, healthcare proxy, if you don't have power of attorney, that's a document that needs to be drafted and signed right away before we do anything. So again, I don't want this video to be too long, and so I'm going to cover one more team member. So the first team member you need is a decision maker in the family, and the second one is a care manager or an elder care consultant or an elder care expert like us. This is someone who knows the elder care system inside and out. Someone who can help you navigate options, coordinate care, advocate for your loved one, and translate the medical jargon into plain old English. For many families, a care manager right now is not a luxury. A long time ago, people thought people who are rich would hire care managers. This is not a luxury. They are an investment that will save you time and money. No, it will save you time, money, and heartache. Now, let's talk about what do they do anyway. Someone like me as a care manager, and I'm not saying that you need to hire a clinician because I am one of those, but it would be best to hire a clinician because there are people doing care management. They're not clinicians. The reason that you want to bring a care manager who's a clinician is because they come in with a medical background. They come in, they're looking at your case from a nursing perspective. They're looking at the case, they're looking at medication management, which is very important. They're looking at chronic disease management, which is very important. So that is why it's important to have a care manager with clinical background. There are a lot of people doing care management because they've been in the healthcare system. They are maybe, social workers, they are great. They know how to navigate the healthcare system, but a clinician would be best. Number one, what do? They will make an assessment, assess what the needs are. No. So what is an assessment? Assessment is gathering information, getting gathering medical information, social, cultural, emotional, physical, everything that person needs. The home, their community, everything. Assessment means gathering information because you can't make a decision. I cannot help you if I don't have all the decisions, all the informations. And so, first part, the first step of anything an a care manager will do is gather information. They will gather medical history. They will look at medical history. They will look at what what health problems that that person is dealing with. They look at uh, specialties because most older adults they have several specialists. They might have a cardiologist. They have an internal medicine. They have a cardiologist. They have may have a lung doctor, a GI doctor. So they have a lot of specialists that are in their case. But one of the problem is they don't talk. They don't communicate. They work in silo. So what the care manager does is being that bridge between all these people and 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 and, and communicate, build this communication. And so part of the assessment is gathering not only what is going on medically with that person, chronically, or something that it could be um, not chronic disease, but chronic stuff, according to medication, and who is caring for that person. That's part of assessment. And then the environment where the person live, where do they want to go, where do they want to age, how do they want to age, how much is that going to cost? So that's part of all the assessment. So they look at the need from an objective perspective. They know the local facilities. They know the local resources. They know the providers that they can refer you to. They can tell you which assisted living community is right for someone with Parkinson's versus someone with Alzheimer's. They can coordinate between doctors' appointments, therapy, and home care agencies. They can attend care conferences at hospitals and skilled nursing facility. They can be that translator for you when Medicare denies coverage and you don't understand why. You are trying to do all of this yourself while also working full time, raising kids or taking care of your family, living your own life. That is what we call the sandwich generation. When you're trying to do all of this by yourself, it can be very overwhelming. A care manager is the person who says, I've got this. Let me handle this for you. Let me coordinate this for you so you can focus on being the daughter. So you can be focus on being a spouse. So you can be the son. So how do you find one? Well, you're talking to one right now. Okay. You can reach us at gentleshepherdcare.com or give us a call at 704 209 209 704 209 5040. You can call us, ask for a consultation. It's easy. We'll talk with you. We'll answer your questions. You can look for one, a certified care manager. You can go through the Aging Life Care Association. You'll find one that's close in your area. They have a directory, and or you can ask for references. Ask about their experience with what your loved one is dealing with, specific conditions, and establish a relationship with one of them right now. Establish relationship with a care manager before you need them urgently. Before That's not when you look for care managers, not when things are falling apart. You look for one right now. You make a decision right now. You see how much it costs. You put all of those numbers together. As a matter of fact, it will save you money. It will save you money. It will save you heartache. And like for one of the things that we do is make sure we do what we call a clarity assessment. Make sure everybody has an assessment. So what the assessment does is to help you build up system, put things in place before things happen. And so once you have a beautiful elder care plan set up, then all have to do is execute it when things happen. Anybody in the family can have a copy of it. Your power of attorney person, the decision maker, have a copy. Family members has a copy, and so they are communicating your mom, communicate your mom's wishes and things like that. So it's easy. So as I said, I don't want this video to be too long, so I am going to stop here and I will continue. So uh, the two people that I talk about today in the team that you need, every older adult need. Number one is the decision maker. Number two is the care manager. I always call the care manager. That person is the captain of the ship. She directs, she moves people around and get things done efficiently and cost efficiently too. Also, so if you here and you have a loved one, mom, dad, and you have a question or anything, don't wait until you need someone someone one of those people on your team to call them. Don't wait when mom falls to start doing something. Don't wait when she's healthy, when everything is well. That's when you need to have a conversation with someone like me. And so, thank you for listening today. Come back next week. I will continue this conversation. Who else need to be in the team? There are 5 people. So today we only covered 2. We have 3 more to discuss. Have a wonderful day. And hey, let's take care of these older adults.